everyone, my name is Whitney and I am a dental hygienist. Let's talk about signs that your root canal failed. I've done quite a few root canal videos now. I used to be an endodontic dental assistant. Endodontics is the root canal dental specialty, and so one, I'm super comfortable talking about root canals, and two, once you make one root canal video, you just can't stop. So I'll of course link all of my other root canal videos in the bottom or below if you'd like to learn more about what it really is, the process and procedure, safety concerns, questions, etc. But for the purpose of this video, let's talk about root canals failing. What are the warning signs and how to avoid them altogether? So a failed root canal is when your treated tooth experiences some type of complication, such as reinfection, pain, or a breakage in the tooth. There are several different reasons why a root canal can fail, more on that in a bit, but it's important to know that it is super rare for that to happen. You generally have less than a 5% chance of a root canal failing. This is because root canals generally have a success rate of 95% or more. So how can you tell if something is wrong with your tooth after a root canal? Here are the 7 most common warning signs to look for. 1. Pain. One of the most obvious failed root canal symptoms is pain or discomfort coming from that part of your mouth. It could be a sharp pain or more of a dull, throbbing ache. Or it might not even hurt except for when you're biting down or releasing pressure in that area. The pain could be as soon as your numbing medication wears off that day, or it might not develop until days and weeks following your appointment. 2. Tooth sensitivity. Tooth sensitivity after a root canal is not normal. If temperature changes or stimulation from something like a toothbrush bothers your tooth, something might be going on. Theoretically, your tooth shouldn't feel anything after a root canal because all of the nerves have been removed. So if you're feeling something, it's definitely a warning sign. Number 3, swelling. You shouldn't experience anything more than some minor gum irritation after a root canal. It's okay for the gums to be a little bit tender because the nerves are all still on your gums, right? They only removed the nerve of the tooth itself, but that gum irritation is usually where the injection was administered, where the numbing shot was given. However, if you have severe swollen gums or any inflammation on your jaw or the sides of your mouth that the root canal was on, that could indicate something else is going on. Be sure to call your dentist ASAP if the swelling starts to spread throughout your face. Number 4, discharge or pus. Dental abscesses have to drain somehow, which is why some of them create sores on the gums next to the roots. The discharge can also come up through the cavities or cracks in the teeth. You might also notice it along the gums if you press down on the tooth. This is not a good sign to see pus post-root canal. Number 5, boils or pimples on the jaw. Active abscesses create cysts inside of the bone and gum tissues, creating a fistula or a fluid-filled pimple on your gums. And although fistulas can come and go, be sure to tell your dentist even if it only happened once, because it probably will happen again when you least expect it, and you don't want that. Number 6, sinus problems. If you seem to have sinus problems like congestion or a runny nose, try to think about whether or not it has been going on since you had your root canal. Sometimes your upper tooth roots reach so far that the lining of your sinus cavity drapes over them. And if the root canal treatment penetrates into that lining, you do run the risk of bacteria entering your sinuses, and it's a whole thing. So always tell your dentist if you're having sinus pain post-root canal. It could be happenstance that it's just sinus season for you, but it's definitely worth mentioning either way. Number 7, no physical symptoms. I know you don't want to hear this one, but it is possible that your tooth doesn't hurt at all. You're sitting at your dentist's office getting a regular checkup, getting routine dental x-rays, and unbeknownst to you, one of them shows up with something irregular on it. Your dentist finds something wrong with the root, such as resorption or a reoccurring cyst from an abscess. Whatever the case, the absence of pain does not mean you're in the clear. It just means the main pain receptors have been removed from the tooth. Again, this is so very rare, but in this case, existing infection would still need to be treated, which is called a root canal retreatment. Again, although rare, retreating a tooth with a root canal is a thing, and even though they are rare, they're actually quite successful procedures, especially if you're seeing an endodontist specialist. A general dentist would not normally do a root canal retreatment. You would want to see a specialist for this. What a root canal retreatment consists of is opening the tooth back up and removing the filling material inside of it, and basically doing the root canal again. And before we go, let's talk about how to avoid root canal failures, thus avoiding the need for retreatment. The most important thing you can do is follow your home care instructions post root canal. Specifically, not eating or chewing on that tooth after your procedure. If you're biting down on it and there isn't a permanent crown on there yet, if you still have a temporary, you could potentially crack the tooth or cause parts of it to break off, which could lead to root canal failure. So don't do that. Reoccurrent tooth decay, that's the term we use for a new cavity in a place where you had an old cavity repaired. This can also cause root canal failure. One Once you have your permanent crown, even though the tooth is no longer alive under there, the remaining enamel can still develop cavities, so you still need to practice good oral hygiene around the tooth and its crown to prevent any recurrent decay from developing along the gum line. In all, if you notice any failed root canal symptoms in the days, weeks, or months after your root canal procedure, make sure to tell your dentist. Even though failed root canal therapy is rare, it does happen from time to time, and it's always better to get ahead of it than to wait and let it get worse. I hope this video helped you. Please like and subscribe and turn on the notifications if it did. And if you want more teeth talk, you can visit my website, teethtalkgirl.com, or hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.